Hey everybody, welcome back for another deep dive. Today we're going to be looking at something pretty important for a lot of folks out there. If you're facing hip surgery, or maybe you know someone who is, this deep dive is for you. We're going deep on a Spanish language guide, all about recovering from a hip fracture. Think of it as like your roadmap to bouncing back. And it's put together by the Agency for Healthcare Research and Quality. They're all about making healthcare safer and better.
Yeah, they really are a great resource. It's incredibly thorough and packed with advice that goes way beyond just the medical stuff.
Right. We'll be uncovering those insider tips from what to expect like right after surgery. Spoiler alert, moving is key, even when it feels like the last thing you want to do, to how to prep your home to be like recovery central. Plus, we'll tackle those conversations about things like, well, end-of-life wishes. I know not the most uplifting topic,
Yeah.
but the guide brings it up for a reason. And to help us make sense of it all, I've got our expert here, who's seen it all when it comes to hip fracture recovery.
Happy to be here. I think what's so valuable about this guide is that it really encourages you to be in the driver's seat of your recovery. It's all about asking the right questions and making sure that your voice is heard.
Okay, so let's break this down. The guide starts with like a super simple anatomy lesson. We're talking pelvis, thigh bone, and that ball and socket joint. That gives your hip its awesome range of motion, but then boom, a fracture happens. That ball at the top of your thigh bone, it breaks. Could be from a fall, an accident, or sometimes even just weakened bones as we age.
And this is where it gets interesting. The guide points out that for older adults, a hip fracture can sometimes be a sign of frailty, even a marker of like entering the final stages of life. It's a tough reality. But having those conversations about end of life wishes beforehand, no matter how difficult, they can truly make a difference for everyone involved.
Definitely something to think about. And the guide actually suggests having those conversations with your loved ones and your doctors sooner rather than later. Now let's talk surgery. The guide explains that hip fracture surgery, especially if it's an emergency, often happens really fast.
That's why having a medical representative or a power of attorney in place is just crucial. This is someone who can make those critical decisions on your behalf if you're unable to.
So important to have that sorted out ahead of time. And while we're on the topic of being prepared, the guide also recommends setting up those advanced medical directives. Yeah, it's sometimes called a living will.
This is something I can't stress enough. It's a document that outlines your wishes for medical care, if you can't communicate them yourself. It gives you that peace of mind knowing your voice will be heard, even in unexpected situations.
And they actually provide a link to state-specific forms right in the guide. Super helpful. Now, I know surgery can be a scary thought, but the guide reassures us that most surgeries go smoothly.
Absolutely. And it does a great job of painting a picture of what to expect immediately after. You'll spend some time in the recovery room, you might have some tubes and IVs, and you'll definitely have some help with those first movements.
And the guide stresses how important it is to start moving as soon as possible. Like the golden rule of recovery, right? Even if it feels like the last thing you want to do.
It is. It helps prevent those pesky complications like blood clots and pneumonia, which can really throw a wrench in your recovery.
Another thing to be aware of is the possibility of confusion after surgery. Doctors call it delirium. It's more common in older adults. You might even see it with someone you know. Have you witnessed this in your practice?
Oh, absolutely. And it can be really alarming for family members if they're not prepared for it. It's not just your typical grogginess. Patients can get disoriented, agitated, even see things that aren't there.
Wow, that sounds intense. So what can people do?
The guide has some great tips on how to manage it. Familiar objects from home can help ground the patient. Keeping the hospital room calm, maybe dimming the lights at night, can make a difference too.
I'm thinking about my grandpa, who always needs his old radio by his side. That would definitely be coming to the hospital with him.
Exactly. Those little things can make a huge difference.
Okay, so we've got movement and potential delirium covered. What about pain management?
Pain management is a big one, and the guide doesn't shy away from it. They acknowledge that pain after surgery is totally normal, and managing that pain is really important for your recovery.
So what kind of options are we talking about?
Well, there are a variety of pain relief methods available, from epidurals and pain patches to medications.
Okay, that makes sense. But I'm also thinking about opioids and the potential for addiction. Especially with all the news lately, does the guide address that?
It does, and it's a crucial point. The guide actually emphasizes minimizing opioid use whenever possible, because of those potential risks. Plus, opioids can lead to some unpleasant side effects like constipation, which can definitely complicate things.
So it's about finding that balance between managing the pain
Yeah,
and avoiding those downsides.
Exactly. And there are other effective ways to manage pain, so don't be afraid to discuss those options with your doctor.
Now, I bet folks are wondering, when can I finally go home?
That's the million-dollar question. The guide actually lays out the criteria for being discharged. You should be able to walk with a cane or a walker, navigate a few stairs, eat, use the bathroom, and manage your pain without relying on IV meds.
Sounds like a pretty thorough checklist.
It is. And you'll also be armed with detailed instructions on medication wound care and what to expect from physical therapy. They even mention the option of home healthcare visits or rehab centers if you need that extra support.
Okay, so we've covered the basics. Prep for surgery and made it through the hospital stay. But now comes the real challenge. Recovery at home. That's where this guide really shines, right?
Absolutely. It's packed with practical advice to make that transition as smooth as possible.
Let's dive into that next.
So you're back home and you're probably clutching those discharge instructions like they're the holy grail of recovery.
Oh, I can totally relate to that feeling. It's like, okay, I'm on my own now. What do I do?
Right. But the guide really does walk you through it step by step. It's like having a personal recovery coach right there with you.
I'm loving this coach analogy.
Yeah.
So what does coach say about those first few days at home? What should we be focusing on?
Well, one of the first things the guide dives into is wound care.
Okay.
They even describe what the surgical area should look like so you know what's normal and what might be a red flag.
Okay.
I've seen so many patients panic over a little redness or bruising, but it's actually part of the healing process.
So what should we be looking out for? What does a not so good wound look like?
Well, initially you can expect some redness and bruising. There might even be some drainage for a few days, kind of a pale yellowish fluid.
Okay.
But if you start to see increasing redness, especially spreading out from the incision, or if the area feels hot to the touch, that's a sign to call your doctor.
Okay, what about the drainage? Is there a particular smell we should be wary of?
Yes, infection often has a distinct smell, kind of a sweet, sickly odor.
Ugh.
Think of it like the smell of rotting fruit.
Okay.
Not something you want coming from your wound.
Okay, that's a good one to remember. Rotting fruit equals bad news. What about showering? I know a lot of people worry about getting the incision wet.
Right, it's something we all take for granted, but the guide actually gives specific instructions on when you can shower and how to do it safely. Usually you can shower a few days after surgery, but you'll need to gently wash the incision with soap and water, pat it dry, and avoid any soaking in a bath or hot tub until your doctor gives you the all clear.
Soaking in a hot bath. Sounds amazing right now. But I guess I can wait.
What about other things we take for granted, like, going to the bathroom? That's something I never thought about before reading this guide.
It's definitely something we don't talk about much, but it's a common concern after hip surgery. The guide reassures us that feeling like you need to pee more often is normal and usually subsides within a few days. It's all those fluids they give you during and after surgery.
Makes sense. But what if it's not just frequency? What if there's pain or burning?
That could be a sign of a urinary tract infection, which can happen sometimes, especially if you have a catheter during surgery.
Okay.
So if you experience that burning sensation or notice a cloudy or strong-smelling urine, definitely call your doctor.
Okay. Good to know. Now let's talk sleep. I imagine pain can make it pretty tough to get a good night's rest.
Oh, absolutely. And while pain meds can help, they can also sometimes interfere with sleep patterns.
Oh, yeah. It's a bit of a catch-22. That's why the guide suggests some alternative strategies for promoting restful sleep. Avoiding alcohol and caffeine, especially in the evening, can make a big difference.
That makes sense. I know I tend to sleep worse when I've had caffeine too close to bedtime.
Right. And they also mention using cold compresses for pain relief, which can be really soothing and help you relax. Plus, they offer specific tips for positioning yourself in bed. Sleeping on your back or the non-operated side with a pillow between your legs can help reduce strain and discomfort.
Those are great tips. I'm a
Yeah.
side sleeper, so I'll definitely have to remember that pillow trick. Now, the guide also talks a lot about preparing your home environment. What are some key things people should be thinking about?
It's all about setting yourself up for success. That might mean rearranging furniture to make it easier to move around.
Yeah.
Think about clearing a wide path from your bed to the bathroom and removing any tripping hazards like rugs or cords. Adequate lighting is also key, especially at night when you're groggy and might be on pain meds.
I can totally see myself tripping over something in the middle of the night. It's like our brains go on autopilot when we're tired.
Exactly.
Yeah.
And if you don't have a bathroom on the main floor, they even suggest considering a portable commode to avoid unnecessary trips up and down stairs.
Oh, wow.
You'd be surprised how many people end up needing one.
I can see how that would be super helpful, and it's better to be prepared than risk a fall, right?
Absolutely. They also emphasize the need for help during those first couple of weeks. If you don't have family or friends who can stay with you, they recommend looking into a trained caregiver. It's all about having that extra support during those initial stages of recovery.
Having someone there to help with meals, dressing, and just those everyday tasks would be a lifesaver.
It really would, and it takes some of the pressure off so you can focus on healing. But it's not just about the physical stuff. The guide also acknowledges the emotional side of things, which I think is so important.
Yes, it's not all sunshine and rainbows, right?
Right. It's common to feel a roller coaster of emotions after being in the hospital and facing a long recovery. Yeah.
You might be feeling down, frustrated,
Mhm.
even lonely, and that's okay.
So how can people cope with those emotional challenges?
The guide encourages reaching out for support, talk to loved ones, join a support group, or consider seeking professional help if needed. Addressing emotional well-being is just as important as physical healing.
It's like that saying, a healthy mind and a healthy body, they really go hand in hand.
Exactly. Now, let's talk about another essential part of recovery, fueling your body with the right foods.
Okay, bring on the nutrition advice. What does Coach say about what we should be eating?
The guide highlights the importance of a nutritious diet to support healing and give you energy. Think lean protein fruits, veggies, whole grains, all that good stuff.
But let's be real, sometimes after surgery, the last thing you want is a big plate of broccoli.
I hear you. The guide acknowledges that your appetite might be off food, it might taste different, and you might be more sensitive to smells.
I remember when I had my wisdom teeth out, everything tasted like cardboard.
That's so common.
Hmm.
So in those cases, they suggest eating smaller, more frequent meals throughout the day. Okay.
Listen to your body and don't force yourself to eat if you're not feeling it. Gradually increase your food intake as you feel better.
Small and frequent gut, is there anything we should absolutely avoid?
They specifically advise against alcohol as it can interfere with healing and interact poorly with medications.
So no celebratory glass of wine when you finally get home.
Not quite yet. And if you're a smoker, they urge you to quit, or at least cut back significantly during recovery. Smoking constricts blood flow and impairs the body's ability to heal.
Okay, no smoking and no wine, got it. So we've rested, healed our bodies, and hopefully gotten some decent sleep. Now it's time to talk about getting moving right.
Yes, it might seem counterintuitive, but movement is absolutely crucial for preventing complications, improving circulation, and regaining strength and mobility.
So what does getting moving actually look like in those early days at home?
The guide recommends getting up and moving every 45 minutes or so, even if it's just for a short walk around the house.
I'm picturing myself shuffling around like a zombie.
Hey, you might feel a bit stiff at first, but it gets easier. And of course, you'll start slowly using a walker or crutches as needed, and gradually increase your activity level as you feel stronger.
What about those specific exercises the physical therapist gives you?
Those are gold. The guide emphasizes following your PT's instructions carefully. Those exercises target specific muscle groups and improve your range of motion, which is key to getting back to your normal activities.
So we're not talking marathon training just yet.
Not quite, but the guide does offer practical tips for everyday activities. They suggest finding the best way to navigate stairs, get in and out of a car, stand up from a chair, even how to get in and out of bed safely. These might seem like simple things, but they can be challenging after hip surgery.
It's amazing how much we take those everyday movements for granted until we can't do them easily anymore. What about bending over or twisting? Are those big no-nos?
There, the guide advises against bending over at the waist or twisting, especially in those early ways. Those movements can put a lot of strain on your healing hip and could even set you back in your recovery.
Okay, so we're walking, doing our exercises, and being super careful about bending and twisting. But how do we know if we're pushing ourselves too hard?
That's where listening to your body comes in. The guide repeatedly emphasizes this throughout. Pain is your body's way of saying, hey, slow down. I'm not ready for that yet.
So if it hurts, don't do it.
Exactly. It's better to err on the side of caution. And remember, recovery takes time. It's a marathon, not a sprint.
I love that analogy. It's so easy to get discouraged when you see other people bouncing back faster, but we all heal at our own pace.
Absolutely. Comparing yourself to others is a recipe for frustration. Focus on your own progress, no matter how small, and celebrate those victories along the way.
And remember, you have a whole team of healthcare professionals in your corner. Don't be afraid to reach out with any questions or concerns.
They're there to support you every step of the way. Now, before we wrap up this part of our deep dive, I think it's important to touch on a few more key aspects of recovery that the guide highlights.
Yes. Let's dig into those. Okay, so we're back. Ready to uncover some more gems from this amazing guide. It's like the gift that keeps on giving.
What I really appreciate is how this guide encourages you to be proactive. It's not just about following orders it's about understanding your options and advocating for yourself. It even gives you a list of specific questions to ask your doctor. Questions you might not even think to ask on your own.
Like what? Give us some examples.
Well, for instance, it encourages you to ask about getting back to activities that you love. Things like driving, working, even having sex. These are important parts of life. And the guide recognizes that.
Right. It's not just about physical healing. It's about getting back to living your life to the fullest.
Exactly. And it also addresses those practical concerns, like how surgery might affect your ability to manage everyday tasks, like bathing dressing, using the bathroom. It encourages you to have open and honest conversations with your doctor about any challenges you're facing.
I'm thinking about those grab bars I installed for my grandma after her knee surgery. They seem like a small thing, but they made a world of difference in her confidence and independence.
Absolutely. And the guide actually talks a lot about modifying your home to make it safer and more accessible. Things like installing a shower seat, raising the toilet seat, using non-slip mats. They can really make a difference. It's about setting yourself up for success and minimizing the risk of falls, especially in those early stages of recovery.
Falls are a big concern, right?
Yeah.
Especially for older folks who might already be a bit unsteady on their feet.
Yeah, and the guide highlights fall prevention throughout. It's all about those simple but effective measures, making sure your home is well lit, removing tripping hazards like throw rugs or electrical cords, and using assistive devices if needed.
It's like that old saying, an ounce of prevention is worth a pound of cure.
Exactly. Now, speaking of prevention, the guide also stresses the importance of keeping those follow-up appointments with your surgeon and other healthcare providers.
Those appointments can be easy to brush off when you start feeling better, but they're so important, aren't they?
They are. It's their chance to monitor your progress, address any concerns you might have, and make adjustments to your treatment plan as needed. It's a partnership, and your input is valuable.
And I bet they catch things you might not even notice yourself, like maybe your healing isn't progressing as it should.
Right. And they might recommend additional therapies or interventions to get you back on track. They also often recommend getting a bone density test, especially if your hip fracture was caused by weakened bones.
The dreaded osteoporosis test.
I know nobody loves getting those tests, but they can provide valuable information about your risk for future fractures. And based on the results, your doctor can recommend treatments to improve your bone health.
So it's about being proactive and taking steps to protect yourself down the road. I love that this guide doesn't just focus on the immediate recovery, but also looks at the bigger picture.
It really does. And one of the things that really impressed me about this guide is its emphasis on mental and emotional well-being. It acknowledges that recovering from a hip fracture can be emotionally challenging, and that's something we don't always talk about enough.
Yeah, we tend to focus on the physical aspects of healing.
Yeah.
But the emotional toll can be just as significant, right?
Absolutely. It's a major life event. And it's normal to experience a range of emotions: frustration, anxiety, sadness, even a sense of loss.
Like grief for the life you had before the injury.
Yes, exactly. And the guide encourages you to be kind to yourself, to acknowledge those feelings, and to seek support when you need it.
So what kind of support are we talking about?
It could be talking to loved ones, joining a support group, or even seeking professional counseling. It's about having a safe space to process those emotions and develop coping mechanisms.
It's so important to remember that you're not alone in this. There are people who understand what you're going through and can offer guidance and support.
Absolutely. And the guide reminds us that recovery takes time. It's a process, not an event. Be patient with yourself. Celebrate those little victories. And don't be afraid to ask for help.
So what does this all mean for you, our listener? If you're facing hip surgery or helping a loved one through this journey, know that you are not alone.
This guide is an incredible resource filled with practical advice and evidence-based recommendations. It puts you in control of your recovery and empowers you to make informed decisions.
We highly recommend downloading the full guide. We'll put the link in the episode description and using it as your go-to resource throughout your recovery.
As we wrap up this deep dive, I want to leave you with one final thought. Recovery is a journey, and like any journey, it can have its ups and downs. But with the right information, a supportive network, and a positive mindset, you can not only heal, but thrive.
We believe in you, and we're here to support you every step of the way. Thanks for joining us on The Deep Dive. Until next time, stay curious, stay informed, and keep diving deep.